Welcome to Safe Kids at Home Medication Safety, brought to you by Safe Kids Vermont and the Northern New England Poison Center. Why is medication safety important? Medication is the most common cause of poisonings for all age groups. More than 50,000 children are treated in emergency rooms nationwide each year because they get into a medication. Almost 70% of these visits involve 1 or 2-year-old children. Young children learn about their world through their senses, especially through sight, touch, and taste. They are naturally curious and have poor impulse control. This is why very young children have the highest rate of poisoning, and why it's especially important to include medication safety when childproofing your home. Medication is something used to treat, cure, or prevent an illness or injury. It can be prescribed by a healthcare provider, such as a doctor, nurse practitioner, or physician assistant, or it may be available over the counter without a prescription. Some of the most common medications involved in calls to poison control centers for children ages 5 and younger are over-the-counter pain medications like ibuprofen or acetaminophen. These are best known by their brand names Advil, Motrin, and Tylenol. Other medications commonly involved in these cases are vitamins and supplements, topical preparations such as diaper rash cream, and antihistamines. Children 5 years old and younger account for about half of all poison center calls from homes. Most of these cases are due to curiosity or exploration. Some are due to a parent or caregiver accidentally giving too much medicine or the wrong medicine. These types of medication errors most often involve over-the-counter medications such as pain relievers, antihistamines, or vitamins. They may also involve prescriptions such as ADHD medications. Your poison center can help you safely manage almost all child poisonings at home. A small percentage of poisonings involving young children will require treatment at a hospital or doctor's office. Some of the medications most commonly involved in serious poisonings are acetaminophen, buprenorphine, methadone, and other opioids, ADHD medications, marijuana edibles, and diphenhydramine or Benadryl. Kids are naturally curious and can easily get into things like medicines if they are kept in places within their reach. What does it mean to store medicine safely? Keep prescription medication and over-the-counter medications, including vitamins and supplements, out of children's reach and sight. Use a locked cabinet if possible. Put all medications up and away immediately after every use. Don't let children see where you store medications. Remember that child-resistant does not mean child-proof. Children may still be able to get into these containers. If you need to use easy-to-open containers, it is especially important to store them out of children's reach and sight. Lookalikes are another important reason to practice safe storage. Remember, young children can't read labels, and medications and other products around the house may look like candy or something else that's edible. This is especially true for edible marijuana products. With the growing availability of medical and recreational marijuana, poison centers across the country are seeing an increase in cases of young children getting into marijuana. Even small bites of these products may result in a visit to the emergency room for a young child. It's one more reason to keep all medications, including marijuana products, up high, out of reach and sight. Store medications, marijuana, and other non-food products in a separate place from food and drink. Even parents who store most medications up high, out of reach, may find there are some areas that they didn't think of, such as frequently used medication kept on a nightstand or in a purse, vitamins kept on the counter, or diaper rash products in a diaper caddy on the floor. Usually, when a child goes to the emergency room for medication poisoning, the medicine was within the child's reach. Keep bags up high and out of reach of small children. There are many things in your purse that could be poisonous to a young child. For parents, life is full of surprises, so be as prepared as you can, particularly when it comes to medication safety. Read and carefully follow the directions on the label every time you give your child medicine. The label gives you important information on dosing, ingredients, and warnings. Many of the over-the-counter medicines have the same active ingredients. If you are giving your child more than one medicine, check the labels to be sure you aren't giving the same ingredient twice. The label also tells you about warnings and side effects. Giving your child too much medicine or giving it too often will not help your child feel better faster. Remember to close the medicine caps tightly after every use and put the bottle away right away. When measuring liquid medicine, use the measuring tool that comes with it. This could be a medicine cup, syringe, or spoon. Don't use a kitchen spoon or cup or a measuring tool that came with another medicine. To make sure that the measuring tool doesn't get separated from the right medicine, store them together in a plastic bag. Then, both items can be kept out of children's reach and out of sight. It's important to write down your child's medicine schedule for other caregivers, such as babysitters, spouses, or grandparents. Include the child's name, the name of the medicine, the date and time the medicine should be given, and the amount of medicine that should be given. The amount could be in milliliters, teaspoons, or number of pills. To prevent dosing errors, it is important to read the label so you know which measurement to use. Use a check mark to show that a scheduled dose was given so that you and other caregivers can keep track. If you would like a medicine schedule, you can contact Vermont Safe Kids at uvmhealth.org. Their email address will be available at the end of the presentation. Besides keeping medication up high, out of reach, and reading the label every time you use a medication, here are a few other safety tips that can help prevent poisoning. Always keep medication in its original container or in a child-resistant pill reminder box. Close the container tightly after each use. Never store medication in a household container like a sandwich bag or film canister. Do not take medicine in front of children. They like to copy others. Do not call medication candy. Do not let children play with pill bottles. Teach children to take only medicine from a trusted adult. Use medication made for children. Some over-the-counter medications are not safe for children. It's important to talk to your doctor, pharmacist, or poison center before giving a medication to your child. It's important for visitors and family members to keep their medicine up and away too. Remind them that your child is curious and may get into a suitcase or a purse that's left within their reach. Talk to visitors, babysitters, and other caregivers and share medicine safety information with them. Make sure family and friends save the Poison Help number in their cell phones and post it visibly in your home so they have a number if they need it. 1-800-222-1222. Getting rid of medications that have expired or that you no longer use can help prevent poisonings. Before throwing out the empty container, use a permanent marker to black out your personal information to protect your privacy. The Vermont Health Department suggests dropping off unused medication at a kiosk at your pharmacy or police station. Visit the Health Department site to find a location near you. The Health Department also has prepaid envelopes to mail back your medication. In addition, many towns have medication take-back events, drop boxes, or other specific ways of getting rid of old medications. Call your town office or local police station for more information. Another way to get rid of prescription and over-the-counter medicine is to put the medicine into a sealable plastic bag. Add water to dissolve solid medicines like pills, tablets, or capsules. Don't crush these types of medicine. Add something to the bag to make the medicine less appealing for children and pets to eat, like cat litter, sawdust, or coffee grounds. Do not flush any medication down the toilet unless the label says to. If you have questions about how medicine interact or how much medicine your child should take, call your child's doctor, pharmacist, or the experts at the Poison Center. Your local Poison Center can answer questions about medicines you are getting and giving your child. They can also tell you what to do if your child gets into medicine or if your child was given the wrong amount of medicine. When should you call the Poison Helpline? If you have questions about giving your child medicine, if your child was given the wrong amount of medicine, if your child has taken medicine that he or she was not supposed to. When should you call 911? If your child stops breathing, if your child collapses, if your child has a seizure or is unresponsive. The Poison Helpline is open to take your calls 24 hours a day, 7 days a week. Nurses, pharmacists, doctors, and other poison experts are there to answer your questions. Calls are free and confidential, and experts can help you in more than 150 languages or if you are hearing impaired. You can also chat live at nnepc.org or text the word poison to 85511. If you would like more information on medication safety or would like to request a medication dosing card, please email Vermont Safe Kids. We encourage you to visit our websites for more information on poisonings and injury prevention. Please complete the survey that was included with the video link. This will help us meet our grant deliverables and continue to be funded, and will give you a chance to win a $25 gift card.